this is, people are not reporting all the bright spots in our healthcare system. Today, we have reverse medical tourism. Go to Lagos, go to the hospitals in Lagos. People are coming from India, from sub-Saharan Africa, even from Europe to come and get healthcare in Nigeria. The surgeons, getting surgical operations are cheaper. Today, you'll be glad to know that today we have almost 900 aesthetic offices, hospitals all around Lagos, all around Nigeria. People are coming to get plastic surgery.
Is that people in the private sector, or the people in the private medical sector, or people in the public sector?
People are coming even in the public sector. Go to look today. A cancer center, the National NSIA Look Cancer Center, has the state-of-the-art equipment, whatever you can get anywhere in the world.
The president, Bola Ahmed Tinubu, left Nigeria for Netherlands to Saudi Arabia some weeks ago. And after that, we never heard from him. Sparks a reaction. We talked about this in one of our videos in the past. All of a sudden, he returned nicodemously into the country at night. And many Nigerians, many of us, we all know that anytime the president is traveling, whether night or day, there is always a video clip or even, pictures to show that he has returned or he's leaving. And then a day later, we saw a video of him walking down to the office. Is there anything that the president is actually active, is strong, and all of that? This is the reason why I have always been saying this in the past, that when you don't communicate properly, you give rooms for rumors, for fake news, and for propagandas. But here is the Minister of Health talking about the health state of Mr. President, as well as, saying that the health crisis in Nigeria no longer exists.
I won't disclose personal presidential information in public, but the president is getting some of his care in Nigeria. And I can tell you that.
Right.
And I'm positioned to say, so I have that privilege, but I can tell you, Mr. President Bola Ahmed Tinubu is getting some of his health care in Nigeria. He believes in this, and he believes in Nigerian doctors. He believes in Nigerian providers. We direct this to Nigerians. Nigerian healthcare system is no longer in crisis. We have a president now, President Bola Ahmed Tinubu, that believes a healthy nation is the core to harnessing our biggest asset. And that biggest asset is our human capital.
It is very obvious to the blind that it is not possible for you to tell us that Mr. President do some of his medical, checkup here in Nigeria, and then you say that the health crisis in Nigeria is over. It's not possible. You cannot say that, because if actually Mr. President want to eradicate this healthcare sector syndrome, then he needed to be part and parcel of everything here. And this is the reason why, prior to the election, many called for, to checkmate the candidates who were running for that election to know their health status. Every time, right from the Yadwa to the time of Muhammadu Buhari, we've had this issue of health issues, and which is being held from the public. Is this supposed to be so? Now, the Minister of Health, talking about the Japa syndrome. Let's wait a minute. Just few days ago, the nursing people were protesting in Abuja because of the condition of works and all of that. And some of them have this to say that the salaries and all of that is not to the level at which others are being paid around the globe. And verification issues and all of that. The minister also talks about him eradicating the Japa syndrome, as well as looking at enrolling more people into nursing school and all of that, from 24,000 to over 60,000.
Problem about Japa syndrome, people migrating out, going out of the country, that we have crisis in the human resource crisis. Well, what have we done? We've attacked this in multiple areas. We have a multifaceted approach. We've increased the number of people enrolling in schools, healthcare institutions, studying medicine, pharmacy, medical laboratory science, and medical laboratory science, and all over. So we've doubled enrollment. As we're doing that, also in nursing, we've increased. From when we came, we inherited about 25,000 students were enrolling into nursing school. Today, we have about 68,000 students enrolling in nursing school, and before the end of this year, we'll be enrolling about 110,000 students in nursing school. Remember, we have a population of 220 million. Mr. President has said it over and over. We have to leverage this increased population to our advantage. We need to produce more, overproduce. We know people will go, but as we produce more people will stay. And as we now continue to fix our healthcare system, people will come back, and we're beginning to see that.
But let's ask ourselves a very simple question here. Is the enrollment for the nursing, the pharmacies, and the rest, is it under the full scholarship from the federal government, or individuals has been enrolling from their own pocket? Because if you ask me, every little child that you ask on the street want to be a medical doctor, want to be a pharmacist, or even want to be a nurse. So they have actually worked their way, and their parents is actually enrolling them. The problem here is that Nigerians are not even running out of the country to study those courses. They study those courses over here. After studying, graduated, work for 1 or 2 years, and then they move. Because the environment is not palatable to work at all. This is why the Nigerian government need to put more efforts in order to, bring more facility and to make the condition of our workers more comfortable in order to stop people from running away from the country. The minister also went ahead to talk about people coming into Nigeria to do plastic surgery and all of that. We also talked about that in one of our videos in the past. But then, to emphasize a bit about this, let's not forget Junior Pope, who happens to pass on when he drowned in the river, and a young man who was traveling on the highway that had scissors, and there was no any medical care, that would have been applied immediately, and he passed on after almost 4 good hours. Now, the issue of the coastal highway from Lagos to Calabar has been a subject of debate over the years, over the weeks and months. But let's look at our existing highways. Is there any medical, check at any point in time that you are traveling for over 50 to 100 kilometers from Abuja to Lagos, from Abuja to Kaduna, or Abuja to Kano? You will hardly find anywhere, if not private hospitals. You will even find it very difficult to even come across one on that route. But it is very, very good that either you partner with the road safety, of which you have your first aid and all of that. If anything happened, whether there is network or no network, you will be able to make an emergency call, of which the emergency team can arrive in less than 30 minutes, and this whole drama can be evacuated within few seconds. But we have seen situation where there is an accident on the highway, of which there is no any emergency applied to those who had this accident, and those people passed on. And this was the question passed on to the Minister of Health, of which he didn't even know what to say exactly. But then, in a way, the health sector of the country is the soul of the country. If the health sector is bastardized and being rubbish to nothing, is just like you have killed the nation completely. There are two things that drive a nation to anywhere that they want to find themselves in the nearest future. And one of those things is 1, the health sector, 2, the educational sector, 3, the security. The health sector is the soul, the education is the brain, and then the eye of the country is more like the security. And with those 3 in the top gear of any government, then you will see the nation actually, excelling and being there at the highest level. And that you can see from the developed nations of the world. Look at the United States, the UK, look at China, look at Russia, and look at even some African country. Look at Rwanda and the rest. And look at what Niger is doing now. And the way the military junta are behaving in Burkina Faso, Mali, and Niger will make Nigerians and other African countries believe that even a military ruler is better than a democratic ruler. Haven't seen all that is happening within the country and other African countries within the last few months. What do you make of this? Let's have your take on the comment section. Thank you for watching.